Hi
Hi guys.
guys! Welcome to Sick Faces, a project that conceptualizes chronic illness into makeup looks.
Today we have Bree's story, and she'll be talking about her experience with cancer for the last 5 years, with added chronic illnesses of diabetes and high blood pressure. Our format is going to be a bit different. Instead of having the two separate interview and makeup, we're overlapping an interview to the makeup video. We want to thank Bree and our model Sarah, who stood in for Bree today.
Please do the usual stuff of liking, commenting, subscribing, and tune in.
I would say that cancer is not a relatively well-known disease. I'd say the word cancer is well-known. There are many different types of cancers, and each one has their own treatments. And what people perceive to be as the word cancer is not what is the actual reality of cancer. So when you're going through it, people offer so much advice, from taking these little potions to trying this therapy to the most weird, off-the-wall things you can think of. And they're not in that situation. And you know that they're trying to be helpful, but they actually have no clue as to what you're going through, why it happened, and all the rest of the things that are happening.
That makes sense. Then I'm interested, prior to your diagnosis of cancer, did you feel that you had the same perception that people without cancer now had?
Cancer was not even on my radar. I never thought about it. I remember watching an ad when I was a child where they had that word that said cancer, and then this guy came along with a huge sledgehammer and he hit it, and it said, and then just the can was left, and it said cancer can be beaten. And that's about all I ever thought of when I thought of, well, if I even thought of cancer. I had never even thought of cancer until I was diagnosed.
Yeah. So how did that manifest for you? So what were the symptoms that led you to go and get tested for cancer?
Well, basically, I'd been feeling a little bit low, a little bit tired, a little bit, not quite myself. It felt like something's wrong. I think women are generally quite well in tune of their bodies. And I knew something just wasn't feeling quite right. And, I decided to do the self-breast test for no other reason than that's something we women should be doing. And I felt something in my chest. And when I went to the doctor, I actually think I went for something completely different. I said, oh, and by the way, I have this lump that I'm feeling here. And she said, no, not to worry. It's probably just some fatty tissue, but let's go and schedule you for a mammogram anyway. So I said, okay, I honestly don't have the time now. It was in November. We're working towards the end of the year, and there's a lot of things on the go. I'll go next year, Jan. She said, okay, fine, that's completely your choice. So continued through December, still feeling rather tired, but, end of year tiredness, that's mostly what you put it down to, and then went for the mammogram, and basically everything went from there after they did that.
And what was your reaction, whether this is emotional or mental, to the diagnosis?
I think I actually kind of walked, because you have to do the mammogram and then they send you for a complimentary ultrasound. And I thought, okay. And I kind of laughed, thinking this is just weird, And then when the guy did the ultrasound and he says, no, this is looking quite bad and invasive, you're going to have to get a whole team together and we'll send this through to your doctor. And I knew my husband was waiting downstairs for me at Kauai because we were going to have a coffee and breakfast together afterwards. And I was like, this just sounds unreal. So I think the first emotion is shock. And you just start going with the flow. You then speak to your doctor and they say, you need to go for a biopsy. And then you go for the biopsy, and then you wait for those results. And when those results come back positive, then things kind of get real, because you keep on thinking, no, maybe this still isn't quite real.
So now because you spoke earlier about how so many people suggest treatments and potions and little things. Now that you're within your diagnosis, what are if you feel comfortable, what are the treatments that you have undergone? Or even if it's not medical treatments per se, what have you found to perhaps be helpful in treating your diagnosis?
Okay, well, basically, I've run the whole gamut of treatments. I did go the doctor route. A lot of people decide not to and go a more what they call natural route. I decided to trust the doctors and those that whom God had put in my path. And I did the whole chemotherapy. I did the surgery. I did the radiation. And then we had a break. And after that break, you go back for your checkup. And unfortunately, my checkup 2 months later showed that the cancer had metastasized.
Yeah.
So instead of it staying in or being treated and controlled in the breast area, it had moved onto my bones in my spine.
Yeah.
So you cannot then do chemotherapy straight away because you've just done it. Your body will not be able to withstand it. So they did some radiation to that part of the body to ease the pain. And then you start taking anti-hormonal tablets, basically, because you get different types of breast cancer. You get estrogen positive, progesterone positive, you get triple negative cancers and all sorts of different kinds. So mine was what's called HER2 positive, which means it's estrogen and progesterone positive. So it's hormone positive. So it feeds on hormones, basically. So the hormones your body produces, that's what my cancer feeds on. So I had to take tablets to stop those hormones from being in my body so that the cancer cannot grow. So that worked well for a good 5 years. During that time, you just try and stay as positive as you can. Obviously, I'm a Christian, so I had a lot of prayer support. I had a lot of support from my local church. You basically rely on God a lot. Your relationship deepens with Him. I did some yoga when I felt very stressed. I went for walks. I found walking to be very beneficial. That helped ease the backache. It's just great to get out in the fresh air and sunshine. I like to walk by the ocean and just pray as I walked, or meet a friend for coffee. Meeting friends for coffee, that's a great thing. Just going on outings that get out of your head and basically not even thinking about the disease. For me, it was like, this cancer is just part of now what I have to live with. I didn't even tell a lot of people. I told those close to me, my family, some friends, some people in the church. I didn't share it basically on social media or anything like that. Not because I didn't want to, it was a big secret, but because I did not want the cancer to be who I was. It was just part of who I was, and it didn't define me.
I understand that. I absolutely understand that.
Then after the 5 years, basically you have to do scans every few months. We scanned again, and unfortunately it metastasized again to lymph nodes and the other breast and a few other places. So I had to go on a new chemo regimen, more anti-hormone therapy as well as immunotherapy, which I'm currently doing. I've just finished the chemo. I'm on the immunotherapy and anti-hormone treatments. So this has been a journey of, I was diagnosed in 2015, so it's now 6 years down the line.
If you can recall, perhaps since 2015, the best or the worst day of your diagnosis. So you can choose either one, whether it's a best or a worst day, but a day that stands out specifically because of the illness.
I suppose the worst day is when that biopsy comes back positive and that the cancer is malignant. The second worst day was when you told it's metastasized. And then the best days would be days you don't think about it.
Okay.
The days you're just having a normal day and it's perfect and it's just... In
addition to cancer, you also live with high blood pressure and diabetes. How has this layered your experience of your illness?
Okay, well, the high blood pressure I had before the cancer, so that plus the diabetes are both hereditary diseases. The high blood pressure was maybe something that even prepared me to live like I do with cancer, because it's something that you just live with as well. You take your medication, you manage it as positively as you can. The diabetes came along because, I think, of the cancer and all the medications that I had to take. Steroids is one medication that does increase your blood sugar levels quite significantly. And when you're on chemo, you have to have steroids every single time. So I think the diabetes came about through the cancer treatment as well. So that's just another thing that also has to be managed along with it. So you just manage all of them together.
You speak a lot about approaching it positively. Like, what does that in a practical sense mean for you? Or how are you able to use that as a coping mechanism, especially, I'm sure, for people on the outside who are going to hear the story, or even maybe with your family members and other people that you've told? They might look at the situation from the outside as a very dire circumstance. How then, for you as a person living with this illness, are you able to conjure any positivity from it?
I think a lot of it has to do with God's grace in a way. He gives me the grace and the strength for each day, and you live one day at a time. Living with the kind of things that I do, it's almost sometimes like having a shotgun to your head and playing Russian roulette. So every single day, you take it and you say, well, let's hope that this is going to be a great day. So you stay positive throughout that day, and you live each day as positively and to the best way you can for that day. Whether you're tired or you're feeling a little bit sick or you've got boundless energy, you just choose that day and you make the best of it that you possibly can.
Now, getting more into our project, I wanted to ask, is there in any way that your illnesses or the diagnosis of cancer has changed the way that you perceive yourself?
That I perceive myself? I think one of the things is you learn not to sweat the small stuff. I know that's a book title, but it's true. You don't sweat the small stuff, and literally almost everything is small stuff. There are obviously a few other big things that come along, like COVID and mental illness and so on like that. But otherwise, I guess all of it is small stuff. So you find you don't argue as much. You just tend to take things a lot more easily.
That makes sense. And if you were to describe the relationship that you have with your illnesses, whether that's cancer, high blood pressure, or diabetes, having to manage all of this, how would you describe that relationship? Is there a relationship? Maybe let's start there. Is there a relationship? And if yes, how would you describe your relationship to your illnesses?
Well, in a way, in the beginning, I guess it's pretty much like the picture I sent to you. You become a warrior. You have to fight literally day by day for your life. Especially that first year, you're like in a fight for your life, literally, and you continue fighting, and when it metastasizes and you get another diagnosis of another severe illness, you fight again, and you go through a gamut of emotions, and you need to fight those emotions and learn to continue living in a way that is positive, because that for me is the only way you can get through it, is to stay positive and peaceful. My peace is very important to me, so you need to stay peaceful as well. So the relationship you end up having when you have to live with all these things is basically like a symbiotic relationship. It's just part of who you now become.
So you already spoke about the picture that you sent, and in the picture it's predominantly black, and the markings that you have are tribal. Were there any colors that you would denote to your illness or not?
Well, not really. I think the picture was just in black and white that I found, and I liked the picture because it portrayed a warrior. And there is a tribe, basically, when you have cancer. There is a tribe that I had around me, other young ladies who had also been diagnosed with cancer. We were in a group together. Unfortunately, I'm one of the few left who are still surviving today, maybe with one or two others. So the colors I often think of when I think of it is like purple, which is royalty and healing. Yes, for the despair that you do go through on occasion, because it would be silly to say that you don't go into the depths of despair, especially in the beginning. There's a lot of tears and why is this happening kind of thing. And then I guess green as well, because green is like the color of nature, regeneration, renewal, hope, and it's just one of my favorite colors that makes me think of life.
I think we've gone through all the questions, and this has been very insightful. I don't know if there's anything that you would like to say or add, or perhaps anything.
I think what I found when you tell people about your diagnosis, and then they, often there's sometimes pity, and then they say, you sometimes feel guilty, like maybe it's my fault, maybe I did something wrong to deserve this, or I didn't look after my health properly, or, you kind of think those things maybe. And those aren't helpful things to think. And when people offer you advice, just basically smile and nod, because it's their way of showing that they care and that they're trying to help. They don't know how else to help. And when people offer help, like if they offer you a meal or just to come and sit with you, then, just say yes, because even though you might not need the meal or you might not need the company, it's actually for them. And it's to help them as well, to feel like they're doing something. So you're actually extending a hand of kindness to them during a time that is also possibly difficult for them, even though they don't quite understand everything.
With that said, I would like to ask a question. I think this would be a brilliant last question, is if you were to advise people on how to help you, because you've just described how you can help others who are trying to help you but are probably not doing the best thing within your interest, how would you advise people to help those diagnosed by cancer or who are having to navigate multiple chronic conditions?
Often I think people can't help with it. Not for me. It's only something between God and I don't really think anyone can help, other than perhaps when you meet for coffee, just to treat me like Brenda, like the person that I am, that you knew before, that we just laugh and we have fun, and life is just normal. It's life. It's not sickness, it's not death, it's not fear, it's not anxiety, it's not hopelessness. It's just life.
That is a very perfect note to end on. Thank you so much for tuning in. Don't forget to like, comment, and subscribe, and we'll see you for the next episode of Sick Faces.